believe we are live here on the WMAR 2 News Facebook page, along with our YouTube page, and I believe we're on GBMC's Facebook page as well. Thanks much for joining us for this special Facebook Live discussion. I'm Christian Schaffer from Good Morning Maryland here on WMAR, and I'm joined by Dr. Jennifer Heller. She is the Medical Director of the Wound Center at GBMC. We're going to have a discussion about wound care today. Good morning, Dr. Heller.
Good morning. How are you, Christian?
Great, and it's good to see you again and talk about an important issue that affects a lot of people, pandemic or no pandemic.
Absolutely. Wounds are here like time doesn't stop.
So what are some of the changes that it's been like for you in the past few months? Because I understand you have patients that need to be seen regardless of whether businesses are open or closed, or people are supposed to stay quarantined or not. What have the changes been like for you over the past few months?
Well, we certainly followed the recommendations and standard put forth by the governor, and we fit the urgent emergent criteria for medical care. So certainly what we did at the very beginning of the pandemic was to tailor the needs of our patients and their safety, of course. As a wound care center, we are very strict about making sure that we all have the proper PPE in place. And we also, uniquely, as the pandemic started, we changed how our staffing resulted with care of our patients. So prior to the pandemic, many nurses and a provider would see one patient. And so in order to decrease many people coming in and out of one patient room, we limited it to just one consistent nurse and one provider. So we did that as well.
Yeah, that's a big change. And it strikes me, and tell me if I'm wrong, but that seems like some of the people who might have wounds that don't heal properly or over a certain amount of time, maybe some of those patients are older or have underlying conditions. It just sounds like it might be some of the same people who might have concerns about the coronavirus in the first place.
Absolutely. And so that was a little bit tricky. And so what we did was we really took it on a patient-by-patient basis. And it was a little bit of a risk balance, how bad the wound was, how frequent I felt that the patient needed to come in. But certainly we balanced that with the amount of care that they would have at home with their dressing changes. Really, the hospital, we feel, is one of the safest places, although it sounds ironic, to come in for your medical care, because we're very, very strict and follow the national and state guidelines.
Yes. So does the actual illness have any impact if someone were to have it with the way that a wound would be treated going forward, or is it something that just has to be dealt with separately?
The coronavirus?
Right. Yeah.
There isn't much data yet looking at the connection between delayed wound healing and the coronavirus. There have been some early reports that do seem to note an increase in the prevalence of thromboembolic phenomenon or clotting disorders. So perhaps we may see that, the complications of clotting disorders and wounds created from that. But for now, we haven't yet.
But the bottom line is, too, at this point, if people feel like they need to see you, they shouldn't feel like they have concerns about going to a hospital, and certainly not GBMC at this point. Is that correct?
No, absolutely not. We have been seeing new patients throughout the pandemic and continue still to do that. And we continue to adapt as regulated again by GBMC and, of course, Governor Hogan.
Can you talk some about what kind of wounds you do see? Are we talking about recovering from surgery or accidents? What do you help people with at the wound center at GBMC?
We really see a very wide variety of wounds. A wound is really any break in the skin, and it can happen, as you said, Christian, from an accident, from trauma. So we'll see a variety of different interesting accidents, people banging their legs against a car door, or now we're seeing more in-house accidents. Unfortunately, we've seen several burns from people because they're inside, more hot tea, more hot water, more cooking, banging the leg on the dishwasher. Aside from direct trauma, as you also stated, we do see wounds that haven't healed as a result of a surgical procedure, and also wounds that result from chronic medical conditions such as diabetes.
What are some of the factors that prevent wounds from healing properly, or that make it more difficult for a wound to heal, even over, in some cases, a long period of time?
The real important issue about a wound, which is what we talk about a lot with our patients at the GBMC Wound Center, is that really it's not really about what potion or lotion or dressing that we use to put on the wound. It's what is causing the wound to remain in place. Why is the wound taking so long to heal? Is it due to a circulation issue? Is it due to immunocompromise? Is it due to other medications that the patient may be on? And so it's really important to try to figure out what the cause of that wound is, or the cause for delayed wound healing. And once we correct that and identify those factors, then we're able to get that wound to heal and heal permanently.
So that's something that you can help with at the wound center too. If when you find those underlying factors, it's potentially you're able to address those.
Absolutely. And the GBMC Wound Center really stands out in the region because it's multidisciplinary in nature, meaning that we have a variety of different specialty providers whom we can communicate with. So podiatrists, infectious disease, plastic surgeons. And so we all work together in concert and make sure that the patient gets the most expeditious care under one roof.
So a lot of people talk about the underlying conditions with the coronavirus, and one of them that has people concerned, and that a lot of people have, even if they've not been exposed to the virus, is diabetes. It's very common. And why is it that people who have a form of diabetes tend to also potentially have more trouble with wounds that don't heal as quickly? What is the issue there, and what can you do about it when you do see a patient that's got diabetes?
Among other manifestations of diabetes, diabetes is what we call a microvascular disease. And so it tends to target the small vessels in our body. So it can affect these small arteries going to the eye, which is why there's diabetes-related blindness, the small vessels, arteries going into the kidneys, and also the small arteries going into the lower leg and to the toes. And so certainly when the blood flow going down to the foot is compromised, there's less oxygen and less food, so to speak. And so if there's less nutrition getting down to those lower tissues in the leg and foot and toes, when trauma, even slight in nature, happens, the body isn't able to protect or respond as well to that injury. So in some people who have no diabetes, for instance, they may bang their leg and it may result in a bruise or a small superficial wound. Whereas people who have diabetes and this compromised microvascular circulation, that wound won't heal and will actually progress.
And so it's so interesting with the coronavirus having just really emerged, and people are much more comfortable with things that they know everything about. And this particular virus, I just don't feel like everyone knows everything about it. It's just so new. And so you wind up hearing all these different parts of it as more research is done and more patients are seen. But that is interesting because you mentioned feet and toes, and one of the things I've heard is that it can affect people's toes at some point. And maybe it does have something to do with that issue with circulation.
And I think that that's another important part. I think that what gives all health practitioners and epidemiologists pause here is that we're really working in such a dynamic, changing environment where what we've considered important and known a week ago may change with new data next week. And so certainly if people have questions or concerns, that can also be addressed at their visit with us at the Wound Center.
Yeah.
So that's also helpful.
And can you talk a little more just about some of the different procedures that have been in place? Because what's interesting for the Wound Center is that it would not have closed. Like whereas even some hospital functions, certainly many non-essential businesses closed at least for a time, and then had time to sort of put procedures in place to reopen. But you didn't have that. You just had to stay open and continue seeing patients even during the beginning parts of when we didn't understand much about this virus. And now where you are now, has it changed, or are you still just keeping a safe social distancing and all those other precautions in place?
We're continuing to follow certainly the guidelines that Governor Hogan, as well as the GBMC leadership, has standardized for us. So it's very straightforward, and we get many updates frequently during the week so that we make sure that we're in compliance. I would really like to recognize the amazing nursing staff at the Wound Center at GBMC, because through all of this, they remained extremely professional, came into work with a smile on their face, and we all worked together very consistently, providing the best care that we could for our patients. Certainly, patients should know that we have many stages of screening even before they come in to see us for the Wound Center with respect to COVID. So patients will go through questions of screening to make sure that they haven't been exposed unduly to any risky situations. And as well, when they first enter the front lobby of our hospital, they'll be stopped there. The questions will be asked again. We'll be sure about their mask. They'll get their temperature taken. And then again, when they come up to the Wound Center, this will happen all again. As well, it's not just about the patient. The patient wants to feel comfortable that we're being vigilant. And indeed we are. We're all wearing our PPE. Our masks is regulated, again, by our hospital as well as by the state. And we're washing and doing special things so that we're keeping people distant.
And can you talk about what it's like for a new patient? Because most likely they're dealing with potentially something they've never dealt with before, a bad wound. There might be pain involved that they're trying to deal with. There might be other issues related to it. So what's it like? How does someone find their way to you, and how do you assess and figure out what to do for that person going forward?
Well, our hope certainly is for anyone to, if they have a wound and they're concerned about it and they feel that it's not healing on their own, and I guess we can talk a little bit about that if that's okay with you, about when to call. Mm-hmm. If the wound seems that it's getting bigger, or it's particularly painful, or there may be infection or redness in the surrounding area, or they have a temperature for sure, any of those things certainly warrant a call and evaluation by us. I would much rather see a patient who has a wound that's minor to us and make sure that it's dealt with properly than have a patient come in after trying to deal with it themselves after 6 to 8 weeks and perhaps need hospitalization because the wound has progressed without appropriate care.
What are some of the mistakes that people make before they come to see you that you can kind of warn them off of before they make them?
Well, you know what I'm going to say.
I'm a little concerned.
Yes. No peroxide.
Wow.
So peroxide is not helpful. Really, any basic, gentle soap and water cleansing is perfect for the wound bed. Another issue too is that patients will tend to use a lot of antibacterial ointment, like a Neosporin or a bacitracin on the wound. And although that's not horrible, it can tend to make the wound a little bit too goopy and macerate the skin and not help things move along properly. So really just a gentle soap and water, a bandage, and looking at that, looking at the wound. And certainly if it's getting worse or more painful or anything changes that doesn't seem like it's improving, they should certainly give us a call.
It seems like one of the issues you'd have to deal with is you're trying to prevent infection in a wound, right? Or if it is infected, you have to treat that. But maybe some people just they can't tell when it is becoming infected, or they think that maybe it's getting worse, but they don't think it is. Do you have situations happen where a person maybe could have called you sooner, but they didn't think it was that serious until a little bit later than is recommended?
Absolutely. And so I always feel it's better to overcall. Again, increased pain. If it looks like there's, I guess our fancy term is we say slough on the wound. But if the wound looks like it has some material on it that's yellowish or black or greenish that's accruing or collecting on that wound bed site, they should call us. Temperature again, changes in the skin around the wound. So any of those things, anytime anyone is concerned about their wound, that's the time to call. It's better not to wait. Yeah,
because a lot of times you're not sure because you might think it's not that serious and I can take care of this myself. And then if you have a Band-Aid or something on it, and you take it off, and it's like, oh, this is getting worse. I mean, that's
exactly right.
Yeah, that's a tough situation. So what's going to happen once you start with treatment? I mean, are you taking them through an evaluation? And just take me through what happens once a person comes in there for treatment for something that they hadn't planned. Maybe it's an accident they've had in the home recently.
Sure. So once the patient comes into the wound center, they have a very detailed and comprehensive discussion with our nurses here, so they can get a very good idea and a good compilation of the medications they're on, surgeries they've had before in the past, the story behind the development of the wound, any other tests or treatment they might have had in their primary care doctors or patient first, just so that we can get a better timeline and assess what risk factors might have caused or is contributing to the prolonged healing of the wound. Once that occurs, I'm sorry. Do you want me
no, you're good. Please
continue. Once that occurs, we come in, one of the providers comes in and we talk with the patient, we examine the wound. We make a determination about whether or not the wound needs to be cleaned in the wound center or debrided. And if so, we have a variety of different numbing medicines that we use. And then after that wound is cleaned, we make a determination about what kind of medicine or dressing needs to be on that wound and if any other tests need to be obtained so that we can get a better idea about if there's an infection, if there's bone involvement, etc.
I was wondering about pain with some of these wounds. Like, do people sort of sometimes get used to it, or is that an indication that this is a problem, or does it go the other way? Sometimes do you have wounds that may be serious but aren't causing pain? Because maybe sometimes people will take an Advil, take a Tylenol, now you don't feel it. Is that how do you deal with that issue of the physical pain that sometimes a wound or a potential wound is causing?
Interestingly, most of our wounds don't require more pain medicine than typical over-the-counter pain medicine, such as nonsteroidals or Tylenol. And sometimes wounds occur because patients don't realize that they wounded themselves. So with diabetics, for instance, they have sometimes something called neuropathy, so they can't feel the bottom of their feet. So patients can walk around their house without any kind of foot protection in place and actually step on a tack or step on a piece of glass. And unfortunately, that can fester and cause a wound. But yes, we certainly have different techniques for pain control, certainly if we do need to, again, to debride the wound in the office. And if the pain is at a threshold where typical over-the-counter pain medicines are not working, that's also a suggestion that perhaps we need to look at more aggressive treatment. Perhaps that means hospitalization, or perhaps it means that we need to make sure that there isn't something more significant going on.
Is there any guideline as far as how long something should be covered, as far as if it's a wound that gets wrapped? I mean, is there a time frame, or does it really depend? Is each and every one different on each and every patient?
If you're at home and you're dealing with a wound yourself, without us seeing you, I would recommend that the wound probably be looked at every day, just to make sure, again, that the wound isn't getting larger, that there isn't an odor associated with it, or it doesn't look any different. A lot of the times here at the wound center, we will keep a dressing in place and wrap the leg, if it's a leg wound, for about a week. And that tends to be very beneficial for a number of reasons. A lot of patients will have swelling in the wound area, and then the leg is swollen, and it's hard then for healing to occur. It tends to be safer and a more consistent amount of pressure applied to the wound leg when we wrap it ourselves here in the wound center. And it actually tends to be easier for patients to deal with. So we do tend to wrap patients pretty frequently in a dressing that stays in place for about a week. But I wouldn't recommend patients wrapping their own wounds.
That was my next question, because some of you guys have done so many that you must know the right pressure and the right way it's supposed to be on, whereas in many cases the general public doesn't quite know that.
That's correct. And ACE wraps are materials that we can get at home, but we also have additional dressings in addition to the ACE wraps that will provide much more comfort for the patients, and again, apply a more effective compression.
Okay, Dr. Jennifer Heller from the Wound Center at GBMC, just talk real quick about how to get in contact with you. Do you need to get a referral from a previous doctor, or can you come directly to see you? How does that work?
You can call us at 443-849-HEAL. We really do love the last four numbers or letters of our Wound Center. You can also equally access us at www.gbmc.org, wound care. And certainly if you have any questions, we're always available.
Okay, Dr. Heller, thanks so much for coming on and speaking with us today, and best of luck to you going forward, treating all those patients here as the pandemic continues. Thanks for all that you do, and thanks for coming on and talking to us.
Thank you, Christian. Stay safe.
You too. Okay, that's going to wrap up our Facebook Live discussion here on the WMAR 2 News Facebook page. Thanks so much for joining us. Be safe out there. Have a great day.